Okay. I'm trying to find it. One of the things I want you to be aware of with some of these meds, like permidronate, which is also used for osteoarthritis, if they end in arate, like permidronate or risedronidate, those types of things, you got to make sure that the patient can walk and talk. So when these meds are given, they have to be able to sit upright for at least half an hour or walk around, and they've got to be able to drink. I want to say it's at least a liter of fluid, because this medication can actually get stuck in the esophagus. So I want to make sure that that's what we're talking about with Fosamax, that's the teaching point, or whether there's something else as well. So give me a second here to make sure I am doing the right thing, because I think that might be it, but there could be something else as well. Fosamax. Well, $9.25. Are there other areas that you guys want to look at? I think what I'd like to do is another quiz with you guys, and I do want to touch on some antibiotics as well, and then we'll do you normally go 4 hours with this?
Unfortunately, we do get breaks in between and stuff.
Yeah. Okay. That's crazy, because the day people don't do 4 hours of this, they normally do, I want to say about 3, and then I think their teacher comes back in. But you know, to do 4 hours is mind-blowing, eh? Where are you? Of course, I can't find it when I want it. I'll get back to the Fosamax. Anti-neoplastic, anti-inflammatory, anti-gout. That's not what I want. Can't find it. 47. Are there any other areas that you guys want to go over? Particularly, I cannot find it. It's driving me nuts. So I will have to find that in a minute for you. Why is it I can't find it? All right, well, I don't know. I'll look at that. That's the only thing that I will tell you, that esophageal erosions can happen with, as I say, risedronate. So I'm thinking that that's the particular one. So that's what I want to go on. But let me just do some antibiotic stuff a little bit with you guys. And then, as I say, we'll go from there. And as I say, I will make sure that you have all of this. So, anti-infectives. We have 2 types. We've got bacteriostatic, that inhibit bacterial growth. Bactericidal, I always say it's like suicidal, and that's they're killing bacteria. You've got your basic penicillin, that starts out, things like amoxicillin, all right? These are all under the term of beta-lactamase inhibitors. That's what they do. That's the initial one. Then we built on that because the bugs got clever. They were able to break down that beta-lactam ring. So then we developed what is called the beta-lactamase with clavulanic acid. That's things like augmentin. Eventually got to be able to break down stuff like that. So then we turned into our other types of meds, our cephalosporins, which there are about 5 different classes. And of course, each class gets better and better and better at recognizing either your gram negatives or your gram positives. If it's a gram positive, it stains P for purple. If it's a gram negative, it stains red. Your gram positives are your strep, staph, enterococcus. All right. So that's it. And initially, your cephalosporins start out with gram positive, working really, really well for all of your gram positive staph, strep, enterococcus, and then moving into the more, the the gram negative, which are a little bit more tricky and difficult to manage. Do you think that the problem is with some of these meds, by the way, if you're allergic to penicillin, then you are going to be allergic to augmentin because it's still penicillin, possibly even still cephalosporins, by the way.
Move back.
Beg your pardon? Oh.
No, I was telling my son to move back.
Oh, okay. Sorry. Then we've got things like, let's look at some of the ones. Tetracyclines. What would be one of the issues with tetracycline? Anyone remember that?
Enamel erosion.
Yeah, but it binds to calcium. So remember the graying of the teeth, right? So that's the problem. It binds to calcium. So you don't want to give it to young children. You certainly don't want to give it to pregnant women because of that binding. Okay, so it's not recommended for children younger than 8 years old or pregnant or nursing women because of that. Let's see, what else? Okay, I want to mention things like aminoglycosides, which are your gentamicins, things like that. What's one of the big issues with gentamicin?
Tinnitus.
Things like gentamicin. A couple of big issues. Pardon?
Ringing of the ears.
Yes, tinnitus. Yep. Otoxicity. And what else can it affect back here?
Kidneys.
Yeah, absolutely. Good job. That's awesome. So those are the types of things, again, those nephrotoxic type of drugs, ototoxic type of drugs, gentamicin, which is why we do gentamicin levels, because of that, toxic potential, right? What about vancomycin? What's the problem with vancomycin? How are you going to start giving vancomycin? Do you run it fast?
No, you draw labs first and then you administer.
Mm-hmm. Got to go slow with that vancomycin. Why?
Redman syndrome.
Yes, absolutely. Redman syndrome. Good job. When is vancomycin used? What type of infection would it be used? Any idea?
MRSA.
Yeah. Yep, absolutely. MRSA, Staphylococcus. Let me see. And that's why you're going to do your vancomycin levels, by the way, as well. So remember your peak and trough? Remember peak and trough levels? Yeah. Let's see. Trying to see if there's any other ones. Remember with antibiotics, you're always going to give what along with an antibiotic? like I talked about earlier.
Yogurt. Probiotic.
Yes, you can give yogurt as long as you're giving a probiotic. Definitely you want to give a probiotic along with them, okay? So always recommend those types of things as part of the diet when you're taking antibiotics for sure. Let's see. Wow, we are going through a lot of stuff, right? So I'm still looking for my Fosamax thing for you. I'm trying to see if there's anything else that I want to bring out. Those are some of the basic things that I wanted to just cover with antibiotics. So I think what I'm going to do is another quiz. So hang on for me for a minute. Let me see what one would be a good one for you guys. Okay. Okay, let's do this as a group. I would love it if you were able to get on the quizzes thing, but you know, that's fine. We can still do it this way, not a worry. Did I lose you all? No. So we'll do this one and then we'll have a quick break. And as I say, I want to answer some of these ones before we go. All right. The suffix pril indicates which class of antihypertensive med?
ACE inhibitors?
Yep. Should be. You got it. Good. Second generation antihistamine. What's the advantage over the first generation?
Rebound congestion.
Is it less drowsiness?
Yeah. Remember I said the H1 blockers, initially we've got, this is your first generation. Your first generation is your Benadryl, diphenhydramine. Then your second generation H1 blockers are things like your Claritin, right? Allegras, those types of things. So they don't cause the drowsiness. You only have to give them once a day. Okay. And they're actually more cost, for sure. All right, patient is diagnosed with GERD. What med would the nurse expect to be prescribed?
The ranitidine.
Ranitidine. This is your H2 antagonist. Now, probably not so much anymore, quite frankly. This would be a PPI inhibitor. So not some, it really wouldn't be so much this, but out of these, it would be this one. Okay. But anyway, let's just, yeah, there you go. Just so you know. All right. Haha. Look at what showed up. What's the answer?
The rebound.
There's your rebound. That's your rebound because of this. This is your adrenergic. This is the adrenergic. It's going to cause vasoconstriction, but it will do this. So let's just confirm it. Yeah, there you go. All right. Fluticasone. What would this be for?
Rhinitis.
Rhinitis, exactly. You got it. What is this for?
It's a cough syrup.
Expectorant.
When would you use this type of med, by the way? It's an antitussive.
When you're trying to stop the cough.
Yeah. What type of patient might you want to try and stop them from coughing?
Bronchitis. Somebody with bronchitis.
What about surgery?
True. After surgery, because you don't want them to cough and
Bust open their sutures, right?
let's do.
Yeah. There you go. All right. Wheezing and shortness of breath.
Albuterol.
Mm-hmm. Absolutely. These are great, but they're certainly not the first line, are they? Oh, who's waiting in the lobby? She's in. Okay, hang on a second, guys.
I let her in.
Oh, you did? Okay, thank you. I've got to find my... Sorry, let me just... Okay. Here we go. All right. What's a cardiac glycoside? We didn't talk about this, but what ones are cardiac glycosides? Do you remember?
Digoxin.
Digoxin, exactly. So what would be the issue?
The yellow tent.
Yes, digoxin toxicity, right there. You got it. Mm-hmm. What's the answer for that one?
INR.
Correct. Which one would you not give?
Protamine sulfate.
Correct. That's your antidote.
Right.
You've been studying a lot. That's awesome. We didn't talk about nitrates. What do nitrates do, by the way?
Vasodilators.
Yeah, vasodilators, right? So what's not the typical form?
Transdermal.
You want me to show you? It's going to be oral. So these are the typical form because it doesn't go through the what? Liver. When you're giving nitro, you want it to work quick. You want a vasodilating effect. So you don't want that first pass effect, which would happen if you went this route. Remember, anything oral is going to be slower, right? Because it's going to go through, first of all, it's going to go through the liver, so it's going to slow it all down. The other issue is you're not going to get the full effect, maybe half of it. So these routes are going to be not first pass effect, which is better for things like nitrates. Okay. All right, spironolactone, diuretic. What abnormal lab value? It's potassium sparing. So what could we potentially get?
Hyperkalemia.
Did you say hyper?
Hyper, yeah.
Hyper.
Yes, yes, absolutely. We just talked about this.
Scopolamine.
Motion sickness?
Scopolamine.
Yes, you're right. Oh, I'm surprised. Well, I have to say, I would have said scopolamine too.
Right.
So, all right. Oh, I see. All right. See, I read that wrong. The nurse should question the use of this drug as treatment for nausea associated with motion sickness. Okay. So these were the ones that you would use. So I read that wrong. See? Goodness, this is what happens at 9:30 at night, right? That's my excuse, and I'm sticking to it. What class of diuretic is typically used? Which one is it? Remember this?
Osmotic.
Yeah, mannitol, correct. So it would be your osmotic. Your mannitol is really the only thing you could use. What about this one? What are you going to give?
Maybe oxygen, aspirin, and nitro.
Yeah, good job. Yeah. You got to give the oxygen, right? You got to give aspirin, baby aspirin, and a vasodilator. Mm-hmm. There you go. So what is this? What is this type of med?
It's a clot buster.
Yeah, it is a clot buster. Clot buster. Go clot busters. So, so which assessment is the least important?
Increase in urine.
I think it was
Ah,
it's either that or the facial swelling.
it's got to be this one. These would be an issue for bleeding. All of this. This would be concerns for bleeding. Okay. Again, we talked about this. Patients with renal issues. Which one would we not use?
Magnesium hydroxide.
Correct. Much as I love magnesium. C. diff. What would we not use for C. diff? Any idea? I can tell you, but.
Would it be the first one?
So it's actually going to be this one.
I'm thinking the antidiarrheal because
Yeah,
you don't want
it
to
is.
stop you don't want to stop it from coming out.
Exactly. Right. That's exactly. And with C. diff, we actually tend to use vancomycin. Obviously, we would want to use this type of thing. And metronidazole can get used. But this is atropine, right? This is our anticholinergic here. So we don't want to dry everything up. What could potentially happen is that bowel could dilate. And unfortunately, we could cause a perforation. So you certainly don't want to stop the diarrhea from coming out for sure. Okay. Any idea on that one? That's not an easy. I'm sorry?
Antiemetic.
Benzodiazepines.
Lazar.
Risperidone, benzodiazepine, maybe.
Yeah, the benzo. No. Okay.
So yeah, and that's Phenergan. Phenergan is used.
Yes.
I think that's a difficult one. I would think that's a difficult one, actually. We're nearly there. All right, what are we going to give? What anti-ulcer med should the nurse give before a meal? Anti-ulcer med.
Sucrafit.
Mm-hmm. Yep, that's your liquid Band-Aid. All right. So just give me a 10-minute break because I do want to look up the Fosamax for you guys. And then I also want to see if I can possibly email this to you all. Okay. So give me a 10-minute break and let me see what I can do about those two pieces. I do like this, but as I say, if you did quizzes, it's actually a lot more fun than just doing it like this, quite honestly. But you did great. So there's a lot of different ones you can choose. All right. Let's see, just give me a few minutes. I am going to switch this off for a second and have a 10-minute break. And then Okay. I just sent you an email. Hopefully some of you got it. It had an attachment to it that gives you a lot of the outline that we've been talking about this evening. So hopefully you'll find maybe some of it helpful. We'll see. But let me know if you get it. I don't know if anybody can check and see whether they got the email.
I see it.
Okay, good. You can see it? Great. It should be about 8 pages or more. That was just some of it. But it's really just sort of breaking down some of the pieces for you that, let's say, might be helpful. So a couple of things. I did look, you know, alendronate is Fosamax. So any of the ones that end in dronate, Fosamax is the one, they're biphosphonates. And those are the ones that are given for osteoarthritis. And yes, the big issue, there's a couple of issues with it really. Like I was saying, they have to drink, it says here, an 8-ounce glass of water. So at least 250 mils of water. I would say more than that, quite frankly. Once they get up in the morning. And when they take this med, they have to stay upright for at least 30 minutes. So they've got to be able to walk, they've got to be able to talk, they've got to be able to swallow in order to take this medication, because it can cause esophageal erosions if unfortunately they can't do that. So they cannot lie down within 30 minutes of taking this drug. It's a big issue with these particular meds. So for some reason, that was one of the things that was brought out in your medications. Another thing that was brought out is oxytocin, by the way. Oxytocin is a medication that stimulates uterine contractions. So not really my field of what I'm working in. Miss Fales is the one that you would be using, but Pitocin, as I think one of you mentioned, right? Pitocin was on your list. Pitocin. So I did want to bring that point out as well about Pitocin. And finally, statins. What's one of the big issues with statins? Anybody know?
Rhabdomyolysis.
Myalgia.
Exactly. I always say you need to take CoQ10 with them, but yes, rhabdomyolysis, absolutely, myalgia, those types of things are big issues with those types of drugs, okay? A couple of other things. Let me see, Oster, I just want to see if there's anything else that, yeah. Oxytocin, by the way, it helps to enhance labor. I'm looking for the little sheet. I've got all my sheets mixed up. But can you guys see the thing that I sent you? Hopefully. And for those of you, if for some reason somebody doesn't receive it, you know, let me know and say I will make copies for you guys to have. But if you want to just check your emails just to make sure that you have it, that's a good idea to check. Let me see, oxytocin, contraindication. Well, contraindication, you know, obviously drug allergy is one of them. But if somebody has an intrauterine device, for instance, or an ectopic pregnancy, a bleeding disorder, then these are all contraindications to oxytocin. So I do want to bring that up. I mean, these are going to stimulant and contract the uterus. So also things like fibroids, high risk intrauterine fetal positions, all of those types of things, placenta previa, hypertonic uterus. So anything that is going to be of concern to a normal vaginal delivery would be an issue with oxytocin. So bear that in mind. And again, misoprostol and oxytocin are also both in the format of these sort of abortive type of medications. So I do want you to be aware of that. Anything that's called a statin, any statins, by the way. What's one of the other concerns? What types of labs are we going to monitor for our statins?
HDLs, LDLs, triglycerides, and
But with yes, you're absolutely right. So H for healthy, right? H for healthy. We want the HDL to go up. We want the LDL to be lower. I always say L for lousy, the LDL to go down. We're going to measure our total. We're going to measure our triglycerides. What about liver enzymes, by the way? That's the other thing you want to monitor, all right? ALT and the AST. Because if you've got this rhabdomyolysis going on, definitely it can affect the liver. So that's something that we want to be concerned about. And what are we checking? Like urine, making sure the patient doesn't have dark urine. That would be a concern. That would be something that we may notice. Oh gosh, you know, it's affecting their liver. By the way, what type of juice do we not use for anything?
cranberry.
Close.
Or
Grapefruit.
Grapefruit.
Yeah, grapefruit juice, unfortunately, is nobody's friend, is it? Poor old grapefruit juice, right? So grapefruit juice does not get used for pretty much anything. I mean, if grapefruit juice is on a quiz or an exam, you just know that's the one that you're not going to use. It has so many interactions, okay? Bear in mind some of your herbs that, you know, things like ginseng, things like that could be, these are the types of ginseng, garlic, feverfew. That's just mentioning a few of them. I want to say there's a couple of others as well, but let's see. Those are the types of things that come to mind that you want to be careful. St. John's wort is another one. Ginger. So be aware of all those types of, you know, herbs. Let's see what else. Your peak and trough. Please be aware of those types of things. Tetragenic medications. Remember, if somebody is on Accutane, do you remember Accutane for acne? What does the woman have to do? Anyone remember about that?
Pregnancy tests and 2 forms of birth control.
Yes, and they have to sign the I pledge, don't they? Right? So they have to make sure they sign the I pledge for sure. Please be aware, I'm just going over some of the things that may come up. I think I've covered. Do you think we've covered a lot tonight? I'm just saying, I think we have, but do you think we have? No? I feel we've covered a lot.
I think we covered a lot.
Thank you. Let's see if there's anything else off the top of my head.
Is this something that we can access and listen to again, like re-listen to?
Yeah, what I'll have to do is it will take a while to basically this is like 4 hours, right? So what I'm gonna have to do is probably make it into a little YouTube thing, and then I can send it to you as a video that you can listen to. All right. And then a lot of what we talked about and more is definitely on that sheet that I've sent you. So just be aware of that. And I think that's trying to. I'm looking at the little thing. I'm looking. I would definitely say, we talked a lot about actual meds, but it's not just about the medications themselves, right? A lot of these questions basically are looking to see at patient teaching. It may not necessarily be about the med at all. It may be, you've done a drug error. You need to know those pieces that I think Selena mentioned. So a lot of the different things that are being asked, your 9 rights, how are you going to prioritize your meds? Like we talked about albuterol, you're going to give that first. Makes sense. You've got to do a bronchodilator first. Thinking about prescription reconciliation. Certainly making sure you've got all the pieces there. So if a prescription asks for, it's going to say what route is it, what dose is it, are the milligrams there, how often are you going to give it? All of those pieces need to be in place, right? So those are the types of things you need to look at as well. So not everything is just about the meds. It's making sure that you are able to give safe practice. And that's really the most important thing. And of course, a little bit of dosage calc, but I think it's pretty straightforward by now. The things I would sort of remember is the dimensional analysis piece for your more complex stuff. And then really maybe just desired over half multiplied by volume, that basic formula as well, should stand you in good stead. I notice that what tends to happen a lot, by the way, intake and output. It's amazing to me how many people don't read a question properly, and they'll total up the intake, they'll total up the output, but they'll forget at the top it says patient has got an IV going 100 mils an hour for the 10-hour shift or 12-hour shift or whatever it is, and they forgot to add that piece in on it as well. So bear in mind all of these things, and I think you guys are going to do fantastic. I'm really excited about seeing you doing your NCLEX. So you're going to take it in a few weeks, is that right? Is that the plan?
Not at all. We have to do our exit.
Oh. You have an exit HESI to do, or exit, I'm sorry, you have to tell me.
Yeah, our exit HESI.
Okay. And then once you've done that, then you can go on and change the world, right? What do you all want to do, by the way? Anybody know where they want to work?
Ideally, I want to be in the ER.
Okay. That's awesome. Is that where you are now?
No, right now I'm doing long-term care. But my goal is to be ER, ICU, critical care.
Okay. I'm sure you will. That's awesome. Anybody else? No one else knows what they want to do?
I want to do labor and delivery.
Oh, good for you. Miss Fales would be proud. Anybody else know or have a clue, or are you applying to places yet or anything like that? I think, by the way, St. Vincent's has a ER sort of program, doesn't it? Like a residency.
Oh, I won't be here. I'm dipping out as soon as I get done with this term.
Okay.
Yeah.
I'm doing the STAR-RN program at Memorial.
Good job, Sarah. Yeah, I like Memorial. They do a good job for sure. Excellent. And the rest of you, I suppose it would just be a case of wait and see. You're just waiting. I don't know if you know, I finished my nurse practitioner. I've been practicing for about a year now. So this farm certainly helps with all of that for sure. So I enjoy it a lot, a combination of both. So tomorrow morning, I'll be seeing patients and then coming afterwards to Concord after that. So it works in conjunction. It all works together, whatever you do. You know, there's so many different things that you can do for sure. So I think you'll all do really, really well. Look forward to seeing it. So it's 5 to 10. We have 5 minutes. I know you're waiting to clock out. And I have this little code thing. So hopefully you'll all be able to clock out on time. But I think this will at least, you know, as I say, I'll download it. And it might take me a couple of days to get it done for you. But at least you'll have some more information. And hopefully this has been somewhat helpful. And any other questions, or did it give you enough information? Was this the type of thing you were expecting or not, or just trying to plan, that's all, for future?
It was a good refresher.
Good, thank you. Yeah. Keeps your brain sharp. It's like, oh my gosh, yeah, I forgot all about this, that, and the other thing, right? So it is a good refresher. And as I say, there's a lot more information on those sheets as well. So that'll be helpful for you. And, you know, you're welcome to reach out to me if I can be helpful, you know, if you need anything. And I'm trying to think, so you don't know who you have tomorrow night? Just trying to think.
We have a sub, but we don't know who.
Okay. As I say, I've sent you all the email, so you should have that, and you can print that off. But the reason I'm asking is whether you need hard copies for tomorrow night. You probably shouldn't if you've all got the email. So, okay.
Thank you.
You're most welcome. Here's your scan thing. Do you want me to hold this up? We've got about 3 minutes to go, but it's up to you. 3 minutes. At least you're able to stay home tonight, right?
Yes, thank God. Save me some money on gas.
Yeah. Yeah. I would have liked to have seen all your faces, I have to say, you know. But, I mean, we pretty much did 4 hours solid, quite frankly, didn't we?
Yeah, we
We
did.
sure did.
This is what happens when, you know, when I have a strong cup of tea before I start this. I just power through, power straight through.
I didn't know what kind of tea you had.
Pardon?
What kind of tea did you have?
I had, well, I brew my own. So I had Irish breakfast, strong black tea. So probably now I'm not going to be able to sleep. So we'll see. That's what I had in order to keep my brain sharp for this. So, all right. Well, I'm going to hold this thing up, and hopefully you guys are able to clock out. You want me to hold it up here? Here, I don't know, wherever you can see it. Over here. Can you see it?
Yeah.
Okay.
Could you bring it back a little bit? I can't.
This way? Is that?
I'm a C.
If you got it on your phone, it should be able. Just let me know.
Can you move it up just a little?
I'm sorry. Here?
Yeah, that's better.
Sorry.
Thank you.
You're welcome.
Can we leave now once we're through?
Oh, yes, of course. Please do.
Oh, have a good night.
Take care. Good to hear your voice.
Thank you, Ms. Fletcher.
You're most welcome.
Good night.
Good night.
Miss Fletcher, it's Clarissa. I
Yes.
can't clock out. I don't have the extra cell phone.
You don't have the, okay. All right. Well, did it get sent to you?
But I'm on my cell phone.
Ah, I don't know what to tell you. Well,
I
they'll,
was able to clock in,
yeah,
but I can't clock out without the extra phone.
no worries. But they'll just notice it and I'll let them know. Okay?
Okay. Okay.
Take care,
Thank
my
you.
dear. Nice
You
to hear your
too.
voice. Bye-bye.
Nice to hear you too. Bye bye.
Bye. You got it, Melissa? Do you have it? You got it, Melissa? She's already clocked out, maybe. Melissa?